Hello, my perimenopausal ladies, and I really hope you didn't sweat too much last night, that you're not having a hot flash right now, and I really hope that your brain is not too brain foggy because I have some vital information that could really save you years of misery and, in fact, reduce your risk of some major diseases. So listen up, today's video is going to be a really good one. It's actually a remake of a video I made about 2 years ago, but the quality was terrible. I was really nervous on YouTube, and so I have to remake this vital information and put it out there for you today. I bet that you have no idea what the connection between hormonal birth control pills, patches, and rings are with perimenopause. I'm sure you've never connected the two at all. Well, I certainly hadn't until 2 to 3 years ago. I had stumbled upon Menopause Taylor's channel, which I will link to for sure in the description box below. And I stumbled upon a video that changed my world. It was about birth control tablets during menopause and perimenopause. And that whole video opened up my mind, my eyes, and of course, true to form, I did a whole lot of research, and I'm going to share all that information with you here today. So a quick disclaimer, the information is not coming from me, it's coming primarily from this video from Menopause Taylor's channel, and she is a retired OB-GYN, so she's a retired gynecologist. She's written a book on menopause. She is one of the leading experts on YouTube on this topic, and she does consultations to this day with women. So she helps them transition through from perimenopause to menopause. So she is active, she is knowledgeable, and you don't want to miss the information in today's video. So let's get started. If you are in perimenopause, you will know, just like I have known, that these symptoms can be quite severe. They can be quite disruptive. The night sweats can wake you up. You can be drenched. You can have brain fog where you just feel like your brain is not working optimally. You can have mood swings. You can almost feel depressed. You can feel achy. Your joints are sore. You just feel like it's sore to move, really. There's a whole host of nasty symptoms that come with the transition from not being in perimenopause to menopause. So perimenopause can be up to 10 years. And in my case, it probably will be, because I first noticed my first night sweat, I was 40 years old, which is, in my book, quite young. And every time I stop any form of hormone, I go ricocheting right back into perimenopause. I have more knowledge now, so I know that I can use birth control pills for perimenopause. What? Stop the press, right? So I didn't know this until I'd watched Menopause Taylor's video, but apparently it is something that doctors can prescribe. So let's hear from some other experts on YouTube about this very surprising thing, birth control for symptoms of perimenopause.
And the best possible treatment to get you off your hormonal roller coaster ride and put you on a nice even tram ride will be a low-dose birth control pill. Now, the only caveat here is that you cannot be a smoker. Then you can safely take your low-dose birth control pill, and you will take it through to the age of about 55, because by then, most of us are menopausal.
Perimenopause is a phase of transition, is what we call, from normal cycling women getting into the menopausal stage. During this transition time period, most of the women undergo what is called cycle irregularities, having vasomotor symptoms like hot flashes and causing other estrogen deficiency symptoms like breast tenderness, breast aches and all. So when you have met your gynecologist would have evaluated your symptoms and would have suggested you to go on hormone replacement therapy, which is by and large given as low-dose contraceptive pills during that time period of perimenopause.
If you are suffering from any of the 34 symptoms of perimenopause, birth control pills may actually help relieve some of your symptoms. Remember, in perimenopause, your estrogen levels fluctuate rapidly, and they can vary day to day. Hormonal contraception, especially combination pills with that estrogen, can help even out your estrogen levels so that it almost masks your perimenopause symptoms.
So now that you've heard the surprising news or fact, because I bet you didn't know it. I didn't know it. It's not common knowledge that birth control pills not only offer contraception, but they can be used, quote unquote, off label to alleviate the symptoms of perimenopause. And the reason is very simple. It's not complicated. The reason is that they contain the exact same hormones, synthetic estrogen and synthetic progesterone, as HRT. Now, HRT stands for hormone replacement therapy, which is what doctors prescribe for menopausal women to replace the hormones that their bodies are no longer making. So for us ladies who are in perimenopause, of course, our hormones are in flux, but they're in a slow decline. But the fluctuations can be quite wild during that period. The first hormone to go is progesterone. So it's the first one that drops off. And then our estrogen declines as well. And this period of flux can be eased by being on birth control tablets, because let's have a look at what's in them. As I said, it's synthetic estrogen and synthetic progesterone. So on the screen now, I'm going to put a chart of various hormonal birth control ingredients and their names. So you can see right now on the screen that there's a variety of synthetic progesterones combined with the synthetic estrogen, and that's in hormonal birth control tablets. And then now I'm going to put on the screen a list of HRT tablets. Same thing, it's just at a lower dose. So you get a combination of estrogen and different synthetic progesterones, which are called progestins, but you get a variety of synthetic progestins. We won't go into the differences between all of them in this video. That's a whole huge topic and a whole lot of research. But for now, for the purpose of today's video, what you need to know is that birth control pills simply contain a higher dosage of synthetic estrogen and synthetic progestins than HRT does, hormone replacement therapy, but they both contain the same things, synthetic estrogen and synthetic progesterone. Now, I'm talking about the combination ones and not the progesterone-only mini pill that is not used in HRT, because one of the hormones we lose when we're in menopause is estrogen. So we do need to replace that one. And so I'm looking at combination birth control pills, and combination means it's a combination of estrogen and progesterone. And combination birth control pills are really, by and large, the same as HRT, just in a higher dosage. So having this knowledge now, you can see that, as Menopause Taylor says in her video, if you are a woman already on birth control pills,
birth control pills just sail along happily and quietly for as long as you can.
You can just continue taking them and sail along happily into menopause. You might not even know that you're in perimenopause. You may have no signs and symptoms, and you can just cruise along.
If you're already using a hormonal birth control method when you enter perimenopause, you may not even know that perimenopause has begun.
What bliss! Because I'm sure those of you who are watching know that if you are not on any hormonal replacement, the symptoms of perimenopause can be hellish, and it can feel like some days you just feel like you want to die. You're death warmed up. You can almost feel it's almost a form of depression, no lust for life, and it's not a pleasant way to live. So I, for one, am here to tell you the good news that something as simple as a birth control pill, which is easy to get hold of, it's widely available. You don't need to see a special endocrinologist. You don't need a fancy gynecologist. Your doctor can prescribe it. In some countries, like in South Africa, you can get it from a clinic. You can even get it for free. You can alleviate your perimenopausal symptoms and feel normal again. You can eliminate your night sweats and hot flashes. And like I said, the beauty of it is that it's widely available and it's very simple. You're just taking a pill. However, of course, there are contraindications. So not every single woman should be taking or can take the birth control pill. So of course, there's always a few risks associated with any form of anything we take. And on the screen now, I'm going to put the contraindications to taking the hormonal birth control pill. but the main one is for women who are smokers. Smokers should not be taking hormonal birth control.
As with any medication, there are certain women who should not take hormonal birth control. For example, women who are aged 35 or older and smoke should not take hormonal contraception. Similarly, women with a history of liver disease, hypertension, migraines with aura, diabetes, obesity, or a history of blood clots or stroke will likely have different recommendations by their doctor.
But then you would need to speak to a doctor or gynecologist and work out if there is a form of hormone that you can take to alleviate your symptoms. That's a whole nother discussion entirely. But for the majority of women, especially for a woman like me, who is relatively fit, relatively healthy, a non-smoker, hardly drink, I'm not overweight, I've been on birth control most of my younger life and had no bad reactions. And so for someone like me, this is a very viable option. Now, of course, with birth control, there are all the negatives that you get in the leaflet, in the packet. You know, it can cause some negative reactions, but of course, like with anything, these are very minimal. And I think a lot of it is in our heads. If we are worried about something, then we are probably going to think we're experiencing them. Because if I think back to being on the hormonal birth control pill, I've never had a negative reaction. I've cruised along fine. So why would I have stopped? I stopped because I used to believe, and this is the fear-mongering that's out there, I used to believe that synthetic hormones must be somehow bad and I need to get off of them, which I did. And yet, it's not very widely known that birth control pill hormones, synthetic estrogen and progesterone, have a whole host of short and long-term benefits that are actually mind-blowing. And again, I can't believe women don't know about this, which is why I'm here to tell you in this video that there are these incredible long-term benefits. Just remember, this information comes from Menopause Taylor, who is a retired gynecologist, and the benefits are a reduced risk of ovarian cancer by a significant amount, which is mind-blowing. I mean, a pill can reduce the risk of cancer. You can reduce your risk of uterine cancer as well by up to 80%, which is quite phenomenal. Obviously, it depends on how long you're on the pill for. And in fact, the longer you're on it, the more your benefits. It can improve your lipid profile, meaning your bad LDL cholesterol versus your good cholesterol. It can improve your lipid profile and reduce the risk of heart disease. That, to me, when I first learned that, was mind-blowing. And you can Google this for yourself, and you will see that this is a thing. Birth control pills and HRT, because it's the same thing, one is a higher dose, one is a lower dose, can reduce your risk of heart attack significantly. Also, birth control pills and HRT, of course, by extension, but we're talking today about birth control pills, reduce your risk of osteoporosis. So, in one pill, you get, and this is phenomenal, reduced bleeding, or you can take continuously and skip your period altogether. You get reduced PMS, you get stable moods, you get stable hormones, you get all those kind of immediate short-term benefits of being on the hormonal birth control pill, or you could be on the patch or the ring. Same thing, they deliver the same hormones just in a different way. And you get these incredible long-term benefits preventing major lifestyle diseases, which I didn't know about until I'd watched Menopause Taylor's video. And so here you have the humble birth control pill that can actually do so much more. And now it comes along and it can save us from perilous perimenopause, as Menopause Taylor says. And I find this incredible. And so I think that this information needs to be out there. Ladies, you don't have to suffer. Now, of course, there are risks, as I said, associated with the birth control pill. The main one is blood clotting, but of course, that is a small risk, and it is something you need to discuss with your doctor or healthcare provider if you have a history of that. However, as Menopause Taylor says in her video,
birth control pills have more benefits than risks.
The benefits far outweigh the risks. Now, I would like to share with you just briefly my experience. I've been on birth control pills to alleviate my symptoms of perimenopause. I've then been on bioidentical hormones, and then I've gone off and been on nothing. When I'm on nothing, the symptoms come flooding back. It's terrible. I feel horrid. When I'm on the birth control pill, I find it easy. It's easy to take. It's easy to remember. The dose is already there in the pill. I don't need to try and guess at it. When I've tried taking estrogen creams and progesterone creams that you rub onto your skin, I find it hard to get the dosages right. I did it, I tested, I worked with the doctor, and then my estrogen went too high. I got painful breast, which is a sign of high estrogen. And so for me personally, what I've found is that taking the birth control pill for perimenopause, not for contraception reasons, is actually the simplest, the easiest. I can see myself doing it long term. I don't have to be rubbing creams and lotions and just guessing, because as you pump out a pump, if you need to do half a pump, you could be getting it wrong. And it is quite a pain in the ass to sit there rubbing cream on every single day. But of course, each woman can decide which delivery method of hormones she chooses. But it's such a wonderful thing to know that the hormonal birth control, it could be the pill, it could be the patch, it could be the ring that you insert down there. They all deliver estrogen and progesterone, or synthetic estrogen and progestins, and they all do the same job of relieving your symptoms, and they all carry these long-term benefits. So it is quite incredible. And I'm not here to tell you what to do. I'm not here to push hormone replacement therapy on anyone or birth control pills on anyone, but I would like you to have the information, because I think that when you're armed with information that is helpful and useful, and you're not just living in fear, because obviously we hear of the negatives way more than we hear of the positives. So when you're not living in fear, you're now informed. I encourage you, as always, to do your own research, and then you can decide what works for you. And also, you can now try this option of birth control for perimenopause and see if it helps. Does it relieve your symptoms? Because for me, it does. It's amazing. It relieves it. It is so simple and easy, and I don't need to, like I said, go see an endocrinologist, and I don't have to wait until I'm in menopause, because most doctors want you to be in menopause before they are going to prescribe HRT. And in fact, if you're in perimenopause, you probably need the higher dosages that are in birth control tablets, patches, rings, in any way, because that slightly higher dose will alleviate your symptoms more so when you are younger. Menopause Taylor is the one who taught me that as well. So I hope that this information was really useful. I hope you found it something new. I hope you've had food for thought in this video. As always, I encourage you to hit the thumbs up if you found this useful. Share this video with a perimenopausal lady who could just benefit from some relief that something as simple as taking a pill could give her, her hormone birth control pill. If you have any questions, any experiences you'd like to share, please leave them in the comment section below. I always read all of them. I try and reply to as many of them as I can. I would love to hear your thoughts. I'd like to hear if you have any questions regarding anything I said in this video. As I said, all this information is researchable. You can look it all up on Google. You can go and watch the videos. You can go and check out Menopause Taylor's whole channel. It's a wealth of information. But I just think that this is so important. It's something that we just don't know. We are not told that we can use our simple contraceptive methods, patches, pills, birth control rings, for perimenopause. I think it's a miracle. I want to shout it from the rooftops. So if you're new here, please do subscribe to my channel. It is growing, and I do appreciate all the love and all the support. Thank you so much for watching, and I will see you in my next video. Bye.